I'm going to show y'all what the shoulder flexion, so the shoulder moves into shoulder flexion, horizontal ab and adduction. It does internal and external rotation. Those are the main ones I focus on when I do stretches at home or I tell people to do. So for shoulder flexion, I would get close to the person. You always want to support them under their elbow, especially if they have a subluxation, which we'll go over later. But you want to try to bring their arm and have them kind of relax. And then you want to try to bring it up over their head as much as they can. And I have his thumb kind of facing up and away because you want to get the shoulder more open space. So I'm going to kind of use my body to really lean into it until you feel a stretch. I don't want it to be painful, just like a pretty big stretch. And then you want to hold it at the end range for about 30 seconds to a minute. The longer the better, honestly. And I can give he doesn't have a subluxation, so I'm not too worried, but if you have a subluxation, you do need to be careful of that. And we'll go over that. So this is shoulder flexion. Then I'll bring them down to the side, bring them out to over here. A lot of times people's pectoral muscle is really tight. So I'm gonna have his hand open again. And then I'm gonna push into his pec muscle. Is this a big stretch? Is it too much?
No, it's not too much.
Okay. So I'm gonna hold this. If I was at home, I'd hold it for longer, but I'm just demonstrating. All right, and then for internal and external rotation, you could do it in this plane right here, but a lot of people, this is good. Bobby's got good range, but some people, if you're not able to get up to this 90 degrees of shoulder abduction, I'm gonna actually come down here, keep his elbow at his side, and then, yeah. And then I'm going to bring his hand out. This is kind of an interesting motion. Think about like serving a tray out here, but it opens up your shoulder, which you need to actually go overhead. You need that external rotation. It's very important. So that's all for the shoulder. And then depending on your tightness, if you have a lot of bicep spasticity, which Bobby does, spend some time bringing the arm out into extension. That's really important. And then at home hold. And you do this a couple times a day, ideally. And then forearm. So forearm, it can do supination, which is this motion, and pronation. Most people tend to be more tight this direction after a stroke, so I would actually spend a lot more time bringing the palm up. And his arm can be straight too. You want to get both in. So I'm trying to get his hand into supination and elbow extended. And then you just work your way down the arm. So now I'm going to go to the wrist. His wrist is tight. I know that because I know Bobby. But I'm going to get my hand in here. I'm going to stabilize proximal to his wrist. And then I'm pulling back. Got some nails. So, it's right. I'm going to bring it back this way towards me. And again, I don't want to hurt him. I just want it to be a big stretch. A little stretch. Yeah. A big stretch would be if his fingers were straight and his wrists were straight, because you have a pulley system in your muscles. So this would be putting it on like a max stretch for the flexors. So it honestly may not be possible with Bobby because he's got a lot of tightness, but then you'd move to the hand and try to open it up.
They have that ratchet split for stretching it.
Yeah, some people get like a hand paddle they put on, and then you could try to get some wrist extension, but in general, you want to move down the arm, focus on the wrist, then move to the fingers, get them out and extended. So yeah, a lot of times your therapist will give you a home exercise program. Either I take pictures of people doing their stretches, or I have handouts. Some people, just depending on what they prefer. But stretching is important for maintaining mobility. And then, I guess I can show, so scapular mobilizations, we mentioned at the very end. That's something that is a little more skilled. I wouldn't say to do that at home, but therapists do it in clinic. How about if you roll that way?
I do scapular push-ups.
Yeah, scapular push-ups, but just lay on your side, so facing the mirror. Yeah. So this is his scapula. It's kind of like a triangle, so he's got an inferior angle right here, the medial border. So your scapula, to raise your arm, it has to glide along the rib cage, or else it'll kind of get stuck, and that's, some people get like frozen shoulders, stuff like that, if it doesn't move and glide. So you want to make sure it's always gliding. With the scapula, it goes into elevation and depression. So that's gliding pretty well. It does protraction and retraction. It does ab and adduction.
I used to be totally frozen.
You really?
When the heads would have to unfreeze it.
Oh wow. And then I like to, once I do all those movements, I just do kind of circular motions to really loosen it up. And you can go both directions. A lot of times it'll feel good for patients. So you want to make sure in therapy, your therapist is doing this. I do it before stretches, just to make sure it's gliding well. And then we do our stretches. And you can do these in sitting. Side lying is ideal because they're kind of relaxed and you're not going against gravity as much, but you can do it in sitting too. Okay, thank you, Bobby.